Thank you for being here this morning. We're starting a little bit earlier, but you do have a little bit of breakfast. Those continental breakfasts are getting slimmer and slimmer, so I know, but I really appreciate you guys being with us this morning. And welcome to day 2 of the conference. My name is Tamara Kuller. I'm the CEO at RTFH, as many of you know. And again, I just want to welcome you and thank you for being here today. And thank you for getting up early. These are like the early people to the meetings, right? You always get the best parking spots, you get the best seats. If you're like me, you get here early so you can be in the back row. I see you, right? That's how we show up. But I really appreciate that we've had over 1,000 people register for the conference. Our lunch was a full house, so we know you are participating, showing up, and hopefully building your networks, building your camaraderie in this work, and learning and listening and growing together. Yesterday, we kicked off things with a policy conversation from our national leaders, and today we're going to focus on the state, because our work is sort of layered in. We start with federal, then state work, and then local, and all of that work, their policy, the way that they fund our work, do our work, is important in the way that then you perform the roles that you do in addressing homelessness. So I'm incredibly honored to have this incredible panel to come and talk to us today. And it's going to be facilitated and moderated by Helene Schneider, a dear friend, senior regional advisor, late night texter with me from USICH. And I'm going to turn it over to her. Thank you.
Thank you, Tamara. Good morning. So I asked someone from RTFH last night how many staff work, and I think I heard when it's fully staffed around 30. Is that right? 30 people? So think about this conference, 1,000 people, the level of panelists and number of activities, plus they had to do all the regular work about preventing and ending homelessness in San Diego County on top of that. So really just want to express our appreciation to everyone on the team at the Regional Task Force on Homelessness. If we could just please acknowledge our appreciation to them. And it's been an honor here to connect with each of you. And as Ian said yesterday, this is weird to have a conference at this level of expertise specifically for local day-to-day workers, and to thank you for the work that you do. And what we're hoping to do today with this panel is put it into context about what the heck we do at the federal and state level in this big picture, and what does that mean for you on a day-to-day basis. I'm going to take just a few minutes to give a little additional information from yesterday about the federal role, and then as it rolls right in to our panelists and have them introduce themselves, talk about their work, and then how it all interconnects with each other. You know, we talked about a lot of headwinds, right, and a lot of challenges in front of us, and choices that we make, and it's all about making choices, and in terms of your budgets, in terms of your activities, how you spend your money. I do want to highlight a couple of bright spots that we're seeing nationally that also relates to San Diego County. The VA, for example, they had a goal to house 38,000 veterans in 2023 by the end of this year, and they've already exceeded that number 2 months in advance. So that is over 38,000 veterans around our country who have been housed. 96% of them have been stabilized and remaining in their housing. So they're not only looking at getting people housed, but keeping them happily and stabilized in housing and not falling back into homelessness. That means that there's an 11% reduction in veteran homelessness since 2020 and a 55% since 2010. 55% of veterans' homelessness is down since 2010. So if we can do that here, we can, in that population, with those resources, with that coordination, I think we can do that with many other subpopulations as well. So my job, I'm a senior regional advisor. I cover the state of California. I live up in Santa Barbara. I connect with communities all across the country, all across the state, and connect what goes on in Washington, D.C. with California. And one of the issues, and we'll talk about this in the panel, has to do with All Inside, which is a place-based initiative that's focusing on a lot of bureaucracy busting. I call it a lot of wonky stuff, looking at how we can deal with regulations that may be crossing each other in a way that doesn't work and try to break down those barriers. And California as a state is one of the places that we're looking at. So we have some statewide folks to look at how does that all interact with each other, especially as it relates statewide to veterans, to older adults, and to unaccompanied youth. USICH also, I just wanted to alert us that we also put out just this past week a research agenda called From Evidence into Action. And it's really a call to action to communities, to academics, to people who can fund new sources of research around both what would it take to prevent homelessness and what would it take to end homelessness. And the idea behind it is to use good data and good information to tell our story, and also to do the work, and also to have your back. So you know that the work that you do each and every day is based on best practices, that when there are issues that come up in public hearings that maybe bring up misinformation, that you have the data and the resources behind you to back you up. So do look for that in the USICH website. But we do have some challenges, right? There was a recent report from HHS and their Office of Behavioral Health, Disability, and Aging. They're addressing homelessness among older adults. It is the fastest growing age group of those experiencing homelessness, comprising of nearly half of the homeless population, according to Dr. Kushel in her report in 2022. And the numbers are expected to triple by 2030. So if we know that trend, that's information that's daunting, but we know that trend. And so what can we do to buck that trend, right? We're very fortunate this year at USICH that our current council chair was just appointed, is Secretary Becerra, our HHS Secretary Becerra, also a Californian. So I'm very excited to see how healthcare, homelessness, and housing will all interconnect with his leadership there. So stay tuned for, and we'll talk about, I'm sure, a lot about that as well. And I want to end here with a quote that I saw in a very recent report from the Turner Center. This just came out October 2023 about trends in California homelessness. And I think it hits a button. It's things that we tend to say, you know, when you read something, you're like, well, duh, but you need to see it in an academic paper, or you need to see it in some other format that then the media can reuse and look at and cite over and over. But it says this: it can seem counterintuitive that homelessness programs are becoming more effective even while the total number of people experiencing homelessness increases. Both are true because people are moving into and out of homelessness over time. It is not a static condition affecting the same people from year to year. Service and housing programs are helping resolve homelessness for many people, but factors such as shortage of affordable housing and stagnating wages are pushing people into homelessness even more rapidly. To right this imbalance, local, state, and federal policymakers must scale up the programs that work, sustain them, and address the underlying structural conditional pushing people into homelessness in the first place. So that issue of addressing the need, the emergency need that we have right now of people especially experiencing unsheltered homelessness, along with prevention, those bookends we must look at with equal urgency, with new funding in any which way we can. And what we're going to do today is talk about how it all interconnects together. So I'm going to sit down and I'm going to let my panelists here do this work, and also to acknowledge that all the work that we're doing and how much we're working on with people with lived expertise. And I really want to acknowledge the theme of nothing about us without us, and to bring in the voices of people who have been on the streets, the voices of people who have experienced things in ways that work and ways that don't, and to honor and respect those voices. And that's a lot of, I think, of what we're trying to do here today as well. So I'm going to sit down, and I'm going to start with Dashika Wakima, who is our amazing Deputy Secretary for Homelessness for the state of California. Dashika.
Thank you, Helene. Can you guys hear me? Good morning, everyone. Great to be here. And Helene mentioned a few things around collaboration, cross-sector collaboration, health, housing, homelessness. So my remarks as I introduce myself will touch on how the state of California is really trying to forge those cross-sector collaborations at the local level, at the state level, and at the federal level. So as Helene mentioned, my name is Dakshika Vikrama. I'm the Deputy Secretary of Homelessness at a state agency called the Business, Consumer Services and Housing Agency, which is a mouthful. But within that agency, you have two departments that are relevant to our work. The HCD, which is Housing Community Development Department, that does all the Home Key Awards that converted hotels into housing, right? They also do the state ESG program. They do a lot of transitional housing programs for youth. And then you have another department within BCSH, as it's shortened sometimes, the state agency, called the California Interagency Council on Homelessness. And many of you may be aware of that department because that department provides formula grants such as HAP, the Homeless Housing and Assistance Program, and that formula grant goes out to all 58 counties, all 44 COCs in California, and the 14 big cities. Those are cities with population above 300,000. San Diego is one of those. So HAP goes out to all those jurisdictions by formula, and the 5th round of HAP is out right now, and I'll say more about that in a minute. And we also have competitive grants called the Encampment Resolution Fund, and that notice is out right now as well. Those proposals will be due in the next year, end of January, and on a rolling basis, there's almost 300 million available for people to really provide services to targeted encampments and put them on a pathway to stable, dignified housing, and all that comes with it, which you know more about than I do. So part of what we're doing, though, how are we trying to forge cross-sector collaboration with the HAP program, with this 5th round that we have right now? For the very first time, take San Diego, there's a county, there's a city, there's a COC. They will all have to work together and submit a joint application. And when they submit that joint application, they need to accompany that with a regional MOU that outlines the roles and responsibilities of the city, the county, and the COC. So that's one way we really want all of you to be talking to each other and working together and submitting joint proposals to the state. The other thing is data. We collect data through the COCs, and then we aggregate the data at the state level, and we provide that baseline data back to the local governments because we want you to measure your system performance. So there are 6 system performance measures: how many people are unsheltered, how many people are returning to homelessness, how long does it take to get into permanent housing, how many people got into permanent housing. And this is important. Each data point has an equity measure related to it because we want to measure and track racial equity performance as well. So those are the grants and how we are really trying to forge collaboration between health, human services, and housing at the local level through our grant making. Then at the state level, we have a council that is chaired by the Secretary for Housing and Homelessness and the Secretary for Health and Human Services, because again, we are trying to connect the dots at the state level across agencies. There are 4 agencies and 14 state departments on this council. They convene once a quarter, every quarterly over the year, and we have a state action plan. As Helene mentioned, prevention and the bookends, the state action plan is organized by 5 action areas: prevention, interventions for unsheltered people, interim housing, permanent housing, and strengthening systems. And once again, because we want our work to be really informed by lived experience, we have a lived experience advisory board and an advisory committee with community leaders to really help the work of the state around the cross-sector collaboration. And then the last thing, as I end my kind of introduction here, is how we really relate to the federal government. So Helene mentioned All Inside. State of California is one of the jurisdictions that is part of this effort. We have decided to take a person-centered approach, and we are focusing on 3 populations: young adults or youth aged 18 to 24, veterans, and older adults 50 plus. Why 50 plus? Because the research shows that when you're homeless, you present as someone who's 10 to 15 years older medically. So that's why we're using 50 plus as the marker for older adults that are homeless. And we are hoping to really work together with the feds to identify barriers that are preventing you on the ground from helping your clients access housing and services quickly and in an effective manner. And we are hoping to work with the feds then to undo some of those barriers, to provide more kind of ability for you to do your work in the best way possible to serve Californians. So those are 3 ways where we are hoping at the state through our grant making to help locals really work together and do cross-sector collaboration, work with the managed care plans, which Glenn will talk about in a minute, and then at the state level to really break down silos through our state action plan so that we are all working together and not working in our silos, and then working with the federal partners to really, again, break down barriers so that our locals can really do the work the best way they can. So thank you, and looking forward to answering questions later.
Great, thanks. Glenn, why don't we go to you?
Hi, everyone. Can everyone hear me? Sorry, I'm not used to talking into a microphone, so bear with me here. Before I get started, I just want to say I'm very excited to be here, and I just feel a lot of gratitude and honor to be in front of you all, just recognizing all the work that is being done in this room and out there on the front line. So I just wanted to say that real quick. It's not easy work, so just a lot of gratitude for all the work that you're all out there doing and trying to make a difference. So my name is Glenn Sang. I am the Policy Advisor for Homelessness and Housing at the California Department of Healthcare Services. My position is pretty new to the department. I'm 5 months into the job, also very new to California. The reason why I mention that, it's because our department, DHCS, is just further reaffirming that homelessness, it is a top health issue that we're looking to address. With my position, it's also very representative of the direction our department is taking in our CalAIM efforts, otherwise known as the California Advancing and Innovating Medi-Cal, trying to get my acronyms out there. And it's really meant to just address social drivers of health. We're wrapping up year 2 of our implementation, and some of the focus areas that we want to take are, really building up our infrastructure and capacity. We've had a focus on that in the first 2 years. So strengthening partnerships, braiding together Medicaid with other existing resources. So I look forward to doing that further in this position. Other thing I wanted to mention as well, some of the top priorities we have as a department that I'm looking to address as 2024 is upon us is one, do we have any community support providers here, contracted community support providers?
Yeah.
All right, glad to see. And I wanted to say that one thing that's on our radar is to increase or more standardization to reduce administrative burden at the local levels, making things more streamlined. It is, a long process as the health is a new player to this world. So, just strengthening that partnership, streamlining it, but also doubling down on CalAIM. We have community supports. Community supports is our answer to addressing those health-related social needs that our homelessness population faces. We have new things coming online beginning in 2025, such as transitional rent. That's pending CMS approval. CMS is our federal authority. Leading up to then, we'll be looking to design that policy more and further increasing our resources at the ground level. So part of what I'm seeking out to do as this new calendar year turns is really getting more involved at the local levels in the community, hearing from COCs, local housing authorities, braiding together our behavioral health partners, our managed care partners, and also just recognizing too, beginning January 1st, about 99% of Medi-Cal members will be under a managed care plan. So there's a lot on deck. I can probably go on and on with all the initiatives that we have, but just wanted to, highlight a few things that's ahead. So Thank you.
Thank you. Why don't we move down we're going to Okay, Alex, you can go first. We were going to have Javon, I think, go next. That's all right. But just, Javon Wilkes, why don't you start?
Okay, that's fine with me. Keep the flow going, right?
That's right.
All right. Well, good morning. I'm Javon Wilkes. I'm the Executive Director with the California Coalition for Youth. And what we do is, and driven by for the last 40 years, is to improve and empower the lives of California's youth. So that's our focus area. And of course, we focus on youth experiencing homelessness, disconnection, and instability. And in that, we do our work through public policy and advocacy. So Glenn, you gonna hear from us in regards to how, youth are gonna be able to benefit from the housing opportunities through Medi-Cal. So we track those things, and we do that with a membership. We have folks in San Diego that are a part of our members, and also throughout the state of California. And then we also operate the California Youth Crisis Line. That's 24/7, 7 days a week. Majority of our folks that work on that team, volunteers, and they are young people. So we have young people who are literally providing that first response. So we have that, and then we also do programs where we bring young people to Sacramento to, one, be able to experience a conference in which is about them, for them. They actually have a youth empowerment committee in which we make sure that young people's voices are heard as to how we develop the work and the activities that we have. So we bring young people up to also be able to engage with their local elected officials so that they're heard, and whatever resources are available or can become available, their voices is part of that transaction, but also a part of that transformation when it comes to the system. And with that, I've been a part of this agency as a youth and now the executive director. So this work really hits home, and so really appreciate that everyone is here and doing this work. So thank you all for being here. Thank you, Lahela and Tamara, for the opportunity to be here and continue to uplift the work that is happening to improve and empower the lives of California's youth, especially our youth experiencing homelessness.
Thank you, Javon. Thank you. Sharon.
Hi, good morning, everybody. I'm Sharon Report. I'm the Director of California State Policy for the Corporation for Supportive Housing. So I work on state policy around homelessness, and CSH is a national nonprofit and community development financial institution. We advance affordable housing with services to help people thrive. And we do that through advocacy for policies and funding, through equitable investment in our communities, and by strengthening the supportive housing field. Sorry, I have a little frog in my throat. I just thought I'd try to go through quickly some of our top policy priorities for the state for this next couple of years. And our top priority has been, over the last couple of years and going forward, ongoing funding at scale from the state for housing and services. We feel like this is really the critical next step. We've taken a lot of bites at the edges of policy, and now we really need to do what we know we need to do to fund evidence-based solutions to homelessness. So we're going to be doing that through two different avenues. One is in securing a revenue source for ongoing funding. And we work in coalition with the Bring California Home Coalition, and Alex is going to be talking more about that as well. But through that effort, we hope to introduce legislation this next year to create an ongoing revenue source. And we don't actually expect it to pass this next year, but we hope it will pass in 2025 to put something on the ballot in 2026 that we could all vote on. We're going to be talking more about that effort in the It's the Housing workshop at 11, so just sorry for the shameless plug, but if you're interested in hearing more about that campaign, please come to that session. The second avenue is through creating a Medi-Cal benefit that would fund housing support services. We think that we should go beyond what's currently available through community supports and actually create a benefit to fund those community supports. Unlike what we have now through CalAIM, a benefit would allow us to provide full coverage of those services to anyone who's eligible for those services. So it would be basically an entitlement for people experiencing homelessness who have certain functional limitations and need to be able to connect to those services to get healthy. We'd be able to scale up how many people are receiving the services, and people would be able to continue to receive those services for as long as they need them. So we think the benefit is the critical next step in really having ongoing funding for housing-based services. The state, Glenn's agency, has indicated interest in creating a benefit. So our advocacy efforts are really around the timing, what the benefit looks like to make sure that it's workable for people on the ground, for providers and people experiencing homelessness, and then the rates. And around the rates, we really do think it should be paying for the true costs of evidence-based services. Additionally, we're working to prevent homelessness by preventing people from who are leaving institutional settings from falling into homelessness. And specifically, prison is a huge contributor to homelessness. We know from the Benioff study that came out, the CASPA study that came out this summer, that 37% of people experiencing homelessness in California have been to prison, which even though I've been working in this space for a really long time, was kind of shocking to me. The secretary of our prison system has said that 20% of people leaving prison, and between 30 and 35,000 people leave prison every year. So just to give you context of scale, 20% of those people are going to become homeless. So that prison to homelessness pipeline, we really feel like we need to interrupt. It does lead to a lot of the disparities that we see in our homelessness population, given the disparities in our prison population. We're currently working to align Medi-Cal resources to identify people who are likely to fall into homelessness once they leave prison, and then provide services to people as they're coming out, as well as redirecting some expected savings from prison closures to pay for the housing, for a supportive housing program for that population. And then finally, just wanted to mention one other item that we're going to be working on next year, which is creating a unified funding application, and we'll be working with NEH and Housing California to do that, which would allow local government agencies and nonprofits to be able to apply to the state through one application for all state funding. So we're hoping to be able to accomplish that this next year. I'll just end on this, that I think it's really, really critical to educate our state leaders about homelessness, people experiencing homelessness, and what works to solve homelessness, because the rhetoric coming from our state leaders around that, those issues, is really, really damaging to sound policy. So we can't really pass any of these things without doing those educational efforts. Thank you. I'll turn it over to Alex.
Thank you. Good segue into Alex. Go ahead.
Hi, good morning, everybody. My name's Alex Vysotsky. I'm the California Policy Fellow at the National Alliance to End Homelessness. First, thank you to the task force for putting on this great event and convening us all. And I really appreciate all of you coming out early this morning. I'm definitely not the guy that's like making it to the breakfast panel, I must admit. So I applaud all of you. And thank you, Helene, for that great framing up front. For those that don't know the National Alliance to End Homelessness, we're a DC-based organization committed to preventing and ending homelessness nationwide. We do that in part by lifting up data-informed, evidence-based best practices to end homelessness. California is the only state where we have a state-level presence, in recognition that, you know, what happens in California really makes waves in the rest of the country. Sometimes that's good, innovative policies and practices, things like home key. Sometimes that's the not-so-good things as well. When California gets it right, a lot of folks follow our lead. When California gets it wrong, a lot of folks follow our lead as well. So it's really important that we bring those kind of evidence-based practices to California and try to protect them in California. And that leads into what our priorities are in California. I'll talk briefly about 3 of them. The first one is California's commitment to housing first approaches and making sure we're not putting up unnecessary hoops for people experiencing homelessness to jump through before they can access the resources of our systems, and making sure we're not making subjective judgments about who does and does not deserve housing. Because Housing First recognizes that everybody deserves housing. Nationally, we're seeing a lot of attacks on Housing First, and we're starting to see some of those gaining ground here in California as well. And opponents around the country point to California and say that California shows that Housing First does not work. Housing First is the driver of what does work in California. And San Diego, I think, provides a really great example of this. You know, the task force puts out this monthly report that shows how many people are falling into homelessness each month and how many people are being housed out of the system. And it paints a really clear picture, right? Homeless services providers are housing a lot of people and doing it in spite of being in one of the toughest, if not the toughest, housing markets in the country. San Diego data shows that over the last 12 months, nearly 10,000 people got permanent housing through these system interventions. That sounds like a local system that's rehousing a lot of people to me, and performing really well, in part because of our statewide commitment to Housing First and to your local commitments to Housing First. I think the problem which the San Diego data shows, and which Housing First has nothing to do with, is that people are falling into housing faster than we can get them out of housing, right? Over that same period of the last 12 months, over 14,000 people fell into homelessness for the first time in San Diego. That inflow has nothing to do with Housing First and everything to do with a severe shortage of housing that's affordable to deeply low-income people. So it's really important that we keep telling that story to the state, keep lifting up those data points to the state to ensure that we can protect what we have in Housing First here. The second policy priority I want to talk about, Sharon mentioned, was ongoing state funding to support local homeless systems. And again, just want to plug that panel at 11 o'clock. Come check it out. So I think we hear a lot about just like the gobs of money that have gone into homelessness at the state level. And I think it's important to take a step back and remember that prior to 2018, there was virtually no support for homelessness from the state. Since then, this administration has made big, bold investments through some of the programs that Deputy Secretary Wickrama mentioned, the HAP program, Home Key, as well as some of the investments through the Department of Healthcare Services as well that Glenn brought up. But these have all been one-time investments to really get homeless systems to scale and to get them to the place where, you know, I mentioned that like about 10,000 people getting placed in housing compared to 15,000 people falling into homelessness for the first time, to get them to a scale where we can flip those numbers, right, and we're bringing more people into housing than are falling into homelessness, we need the state to make predictable, ongoing commitments of funding. You know, from the service provider level, we know it's really hard to get your programs up and running when your funding changes every year, and when you have to swap in different sources of funding. And then on top of that, you have to go back and advocate to your public agencies to say like, hey, we need another year of funding. We need to continue this program that we know is working. All of that uncertainty contributes to the instability we see in the workforce. And at the end of the day, it means we're providing less continuity of services to the folks experiencing homelessness. We don't accept this lack of continuity of funding in many other arenas, right? We would never expect our schools to do a successful job of educating our children if they had to go to Sacramento every year and say, hey, we need to actually make sure we can keep the doors open in 2024. But that's what we ask our homeless services providers to do, right? Is to provide this just like incredibly difficult to provide very heroic level of services without any security that they're going to have funding next year. So the last thing I want to talk about that was also mentioned earlier was pushing back on racist policy in homelessness, because that's going to be another aim of the Alliance in the coming year. It's been talked about a lot, but we all know our homeless crisis is the result of decades and decades of racist policy making at the federal level and at the state and local level. What we used to see was explicitly racist policy. We have things like Article 34 in the California Constitution that allows communities to vote to block affordable housing. Something that was pretty baldly racist at the time when it was put into the Constitution. We used to allow racial covenants that said where you can and can't buy housing based on what you look like. That's not what kind of racist policy has looked like for the last 50, 60 years, though. Policies, can't say the ugly thing explicitly anymore, but what they can do is kind of fail to either A, fail to explicitly call out the racism in our policies, or B, kind of overlay this facade of neutrality on what we all know is a racist society, and then somehow expect these neutral policies to somehow change things. So what that means is sometimes we take important steps, like passing laws to ban source of income discrimination, but then we don't put any teeth in those laws to enforce them. It means, things like we don't allow landlords to exclude people, Black and Latinx folks, explicitly from housing, but we do allow them to exclude people in some cases, based on convictions, when we know that, folks have been sucked into a criminal legal system that has disproportionately targeted Black and Latinx folks. And the last thing I want to close on is, the latest iteration of that kind of policy is camping bans. And that includes the city of San Diego's camping ban that was passed earlier this year. When you pass a policy that says where a disproportionately Black population can and cannot be and cannot just simply exist, that's bad policy. It's ineffective policy, it's racist policy, and it makes it a lot harder to actually solve homelessness. So we want to push back. Thank you. So we want to push back and make sure more of those policies are not passing around the state, and make sure the state is doing what it can to protect from more of those policies passing. Thanks.
Great. Thank you to our panelists. We have about a little over 10 minutes, and what I'd like to do, because we are so fortunate up here to have this particular audience listening to us, because they are the ones doing the work day in, day out on the ground in San Diego County. And because so much of these panels sometimes talk about the big picture policy-wise, but what does it really mean, and how can we engage with those who are seeing everything on a day-to-day basis, individual by individual, who are running into these barriers or seeing things that do work? How can our organizations connect with them and them to connect with us? And as everyone heard, these are 6 of us up here, all focusing on the state of California with our own kind of niche, and how do we put those puzzle pieces together to work in collaboration? So those are the kind of, just kind of big picture topics I'd like us to explore here. I don't have anyone in particular who would like to start. If anyone would like to start with that thought process, I can pick on you too. Go ahead, Dashika, go ahead.
Thank you, Helene. So a couple of ways, and hopefully you guys are already doing this. So I mentioned the HAP grant, which is a formula grant that goes out to the counties, the cities, and the COCs. One of the requirements of that grant, and I'm assuming this is happening already, but maybe soon, that there needs to be public engagement before the application is submitted to the state, and they have a few months to do that. So I would and maybe ask Lahela and Tamara to let you know when those kind of public engagement meetings are occurring, because we really want to make sure that the city, the county, and the COC are really talking to people in the field, talking to people who are doing outreach, people who are working with shelters, people in the medical space, managed care plans. We are really trying to make sure that there's broad engagement, that kind of is incorporated into the proposal before it's submitted to the state. So want to just make sure that I put that on your radar because there's going to be public engagement throughout the state. But in San Diego, if you're here, make sure you are part of that and make your voice heard. The second thing I will mention is, remember I mentioned the state council that meets every quarter. Those are public meetings, so I would encourage you to join those meetings. The next meeting is February 28th, but I'll make sure Lahela and Tamara have those links if anybody is interested, so that you can join. Those are 3-hour meetings where you can really hear cabinet secretaries at the state, 14 department heads really talking about how they want to approach cross-sector collaboration and really thinking about evidence-based practices, data, and lived experience is very much a part of that conversation. The third thing I'll mention is we have a newsletter that goes out. If you go onto the BCSH and then the CalICH website, you can subscribe to the newsletter that really provides a lot of opportunities for funding, but also evidence-based practices, case studies on things that are happening across the state that might be useful to your work. You can also use the CalICH website to submit speaker requests. We also work with tribal nations, by the way. So just really want to make sure that you are aware, because I'll be honest and speak for myself, until I joined the state last year, I used to work for the county and city and a nonprofit myself. I was not aware of all these different things at the state, but I think it's important for locals to really be armed with that information and provide that feedback to us through those mechanisms. The last thing I'll mention is you guys every day do the work and capture data, and I want to just say and emphasize how important that is. I know it seems a lot of work on top of the work you're already doing, but that data then gets submitted to the COC, and each of the 44 COCs submit it to the state. And that's why Turner was able to do what Helene mentioned. Their trend analysis is all using that state database. But I just want to say it's your data, because your data from San Diego and all the other COCs is feeding the state database. And for the very first now, we can have academics use that database to do trend analysis, what's working, how long are people staying housed. They're doing different sheets on older adults, young people, families with children. So I encourage you to go to our data page on CalICH, where you can see the links to the Turner research, as well as some of the data sheets we have done. And then we also have drop-down menus that you can see for 2022 and previous years, all the HDIS data for your community or for the state. So it's just good for you to have that information as you're talking to the public, because this is data you have submitted that is now live on our CalICH HDIS data page. So just a few ways.
Sharon, go ahead.
I think that I know from my work that I cannot alone effectuate policy change. We work in coalition for that reason. We know that we're more powerful when we work together. So we do convene a lot of coalitions and work on a lot of coalitions. Helene had mentioned before people with lived experience being a vital part of that effort. And our state policy really relies on the voices of people with lived experience. So we do have a state policy advisory committee that advises us on our state policy priorities. And I just want to encourage anyone with lived experience to look for expression of interest that we're going to be circulating to add more members to that committee. So that's one way. We do have our Bring California Home Coalition, which I mentioned earlier, and that is a coalition of people throughout the state who really just want to see ongoing funding for evidence-based solutions. And then we also have an older adult coalition of, again, people working throughout the state to solve homelessness among older adults. So we do have those three coalitions, and then we have some informal just partnerships that we formed, and always want to hear from people doing the work on the ground. And those partnerships are really critical to forming our policy priorities. We also have we have staff in 3 different locations in California, and here in San Diego, that's led by the brilliant Saman Ruff, and I work with her a lot to just connect with partners here in San Diego and just encourage you to get involved with our San Diego office as well.
Great. Go ahead, Glenn, and then Alex, and then Javon.
Yeah, I kind of want to plug a few things here. You know, I mentioned CalAIM earlier, and that's really kind of like our Medi-Cal reform. A few things I want to plug. There are some fantastic financial resources out there currently. You know, with CalAIM implementation, you know, we talk about like enhanced care management to meet folks where they're at out on the street. We talk about community supports to address health-related social needs, but I just keep having this pop up in my mind. It's like, you know, there is a lot of incentive dollars out there. I would say that because, you know, we're really trying to lift up the power of CBOs, power of providers, the frontline workers. And these incentive dollars that are out there, it's really meant to build up the capacity and infrastructure between managed care plans and providers, local CLCs. Having worked at the county myself, I understand what that's like, trying to, you know, put out like, you know, pilot agreements, proposals, things of that nature. So I would encourage, you know, you to work with your local counties, your managed care plans, all your partners, because the counties that I see that do it really well are the ones that have that robust collaboration. And I'm not talking about just like, hey, let's schedule a meeting like a month from now. I'm talking about like seeing managed care plans, you know, higher level folks sitting on the boards of COCs, for example, that listen to the providers and talk about, you know, what is needed to really lift up the service being provided to our unhoused population. So I mentioned a few things. You know, we're wrapping up year 2 of our implementation. You know, wholesale changes like this, it does take time, and it doesn't always feel like we have time, especially on the ground level. But we are really, really full steam ahead, doubling down on building up that capacity. I want, if you're not currently, you know, contracted with a managed care plan, I encourage you to lift up your work. I want to increase uptake. Some things looking ahead, you know, there's other, you know, we have like what we call our housing trio that we fund through Medi-Cal, and that's like housing navigation, housing deposits, housing sustaining tenancy services, all those things that I consider like some bread and butter here. There's also other like short-term post-hospitalization, recuperative care. I want to increase uptake on those. I want to understand what the models are where we can combine these Medi-Cal resources with other resources like housing choice vouchers. How do those interplay? And, you know, like my fellow panelists up here are mentioning, there's just quite a lot of efforts, and now looking ahead to year 3, I'm really wanting to place a focus on how do we braid those efforts now? What are the best models, best practices that we can lift up? I think there's a lot of work to be done in that space. Also recognizing that, you know, this is full steam ahead, and, you know, I know things take time and we don't always have the privilege of time, but, you know, I just wanted to reaffirm for folks out there that, you know, there is quite a work to be done, and we're still at it. So just, you know, I myself and my department, we're really focused and committed to addressing homelessness. It is a top health issue for us, and that is also reflected in our CalAIM efforts. So, yeah, just really looking forward to like what's ahead in 2024.
Great. Alex?
Just quickly, how many of you all either have experience of homelessness or work for a service provider? Can you just like put up a hand? So a lot of you all, right? So I think just, you know, our organizations all have these kind of like fancy names, but we are basically, you know, trying to be a voice for you all and trying to be lobbyists for you all. So we can't, you know, to what Sharon was saying earlier, we can't do that without hearing, you know, from what's happening on the ground. We're not on the ground. We're in, you know, talking to folks in Sacramento. We know how the legislature works. We know how to talk to these lovely folks from the state and from the federal government over here. But we need you all to tell us what's going on. So Sharon mentioned some great kind of coalition spaces to jump in, but I know I'm like happy to talk one-on-one with anybody about kind of what you're seeing and what's going on in your community. So just, please come say hi.
Great. Javon?
Hit that WOVA app, and you'll see my face pop up. Click it, and there'll be ways in which you can get in contact with me, look at my organization, look at the information that we have there, and then let your heart lead the way from there, because this is hard work. And again, the population that we are specifically making sure that we elevate is youth. So if you got young people, love them up, give them those leadership opportunities, allow them that opportunity to see themselves in your position by giving them that training. So there you go. Really appreciate, again, y'all time for being here, doing this work, because I know how impactful it is. Again, I raised my hand, lived experience, doing the work. You can say I got myself a little caseload even as an ED. Why? Because the work don't stop. And the time don't stop, right? So tick-tock, got to keep the work going. Thank you all again.
That's great. USICH.gov is our website. Sign up for our newsletter. I connect with the task force on a regular basis, and also when I know Jeff Olivet, who's our executive director, who was here yesterday, and I know he's around somewhere. We do come to San Diego myself or him, both of us regularly. We definitely want to always have time to speak with those who are doing the outreach, who are connecting with people on a day-to-day basis, to connect with people with lived expertise and lived experience, and however that works. And like I said, I'm on Pacific time zone, so and connecting with what's going on in DC and trying to really bring up the research to the reality. And you're the reality. You're the reality on the ground that helps us keep things in perspective. And so thank you again. I want to, as we wrap up, also close understanding that we are approaching a holiday season, which has a lot of emotions that can range the entire spectrum. And I just want to acknowledge that however the end of the year comes around for each of you, that I hope that you take some time for yourself, to take care of yourself, to celebrate the end of this year and acknowledge what's coming up in the next year. There's always work to do, and I hope you take some time for yourself to thank yourself for that you're saving people's lives each and every day. So thank you for that, and thank you for the opportunity for us to speak to you today.
I just have to thank the panel. It's so important to know what's going on at the state, and I personally appreciate them acknowledging all of you on the front line that are doing this work, and they mean what they say. They want to engage with you. So take the time while they're here. Thank you so much, and I'm going to let you guys go ahead and head down, and I'm going to, we're going to continue to talk about work that's being done at a state level. We have the honor and are really fortunate to have Assemblymember David Alvarez with us this morning. And he's going to give you some welcoming remarks and get some perspective on what he's working at in Sacramento. We have a number of both state senators and assembly members, and they are fiercely dedicated in this work. So I'm going to go ahead and welcome up David Alvarez.
Well, thank you. Good morning. I want to start off by thanking each and every one of you for the work that you do. It is really a work of passion. I know that. I've seen a lot of you practicing in the field, walking with some of you as you do your work, you do the outreach, as you try to, as was mentioned earlier, help save people's lives. So I want to first acknowledge you for all that you do. It is often really difficult when you are an elected official to really convey the significance of the work that you do, because unfortunately sometimes we're placed in the spotlight wanting to sort of be able to explain and, again, recognize the work that you do. And I think we do a poor job of that because the work that you do is so much from the heart. I heard that phrase earlier as well, but it's definitely a work of passion. So I wanted to start off by acknowledging that. We have an issue, a problem for sure, that is an incredible challenge for all of us to face. And I recognize that you are the ones who are the face of it. You are the ones who are the troops on the ground who will get this work done. And it's my job, and it's the job of folks like the ones that you had before you in this panel, to try and understand what else can we do, what other tools can we provide to you to get this work done. And that's why I'm here today, because I want to make sure that we hear that. And when panelists say we want to hear from you, we have to hear from you, that is absolutely true, because you know exactly what works and what perhaps doesn't work. So I want to talk a little bit about what we think can help work and identify some of the things perhaps that we need to still continue to work on. Without a doubt, California is absolutely in the midst of a crisis. Homelessness is at the center of it. You maybe already are familiar, heard figures earlier today. 30% of all homelessness is concentrated here in California. Homeless rate of 44 out of every 10,000 Californians is about 2.5 times higher than the national rate. And the issue's only gotten worse in the last 3 years, grown by over 10,000 individuals. But I think with those challenges, like with every challenge, we also have opportunities. And the most important opportunity is that at least those of us that are in opportunities and positions to be able to make a difference have taken note. Because the people of California have said so. 27% of Californians view homelessness and the cost of housing as the most significant issue facing our state. And 74% of voters view this as a major issue as well. So in response to that, what are some of the opportunities that the state has engaged with? I'll share with you just a couple. Over $17 billion on homelessness programs over the previous 4 years. $17 billion. Right now, we have a multi-billion-dollar bond going through the legislature to provide more funding for housing. The governor has placed on the ballot a $6.38 billion mental health bond to help expand access to mental health. And I will talk about the service aspect of it, although my points are focused on housing, because I do believe that you solve this problem with housing. You have to acknowledge that there is also services that needs to be addressed. So while there's been a meaningful impact, we continue to see the challenge before us. Between 2012 and 2022, California's homeless population increased by about half, while another state, comparable size, Texas, decreased by nearly a third. So while we're trying to attack this through the funding mechanism, the reality is that it has become way too expensive for Californians and for people to live here. The statistics speak for themselves. I've seen them. Individuals who are leaving our criminal justice system are at higher rates becoming homeless. Our seniors are at higher rates becoming homeless. Youth, especially LGBTQ youth, at higher rates becoming homeless. These are specific populations that are facing this challenge, and we need to identify ways to be able to serve these populations. Earlier this year, the state's Interagency Council on Homelessness found that the bulk of billions of dollars that we spent between 2018 and 2021 was spent just on the cost of housing. And that is why, from my perspective and in my expertise, I've focused on trying to make housing affordable, making more affordable housing available, and making it easier to build those types of units. So what kinds of things have we done? Since 2016, there are some steps that we've taken, such as reforming Housing Accountability Act in important ways. We strengthened the incentives for developers to build affordable housings, made it easier to build accessory dwelling units, and granted many exemptions from our pathways to streamline the often slow permitting process, which gets in the way of building housing. California added 123,000 housing units, the most since before the Great Recession in the in the last several years. Although this is not enough and more work needs to be done, we are trending in the right direction. So we've talked about ADUs, we've talked about housing, affordable housing funds. We have to make it easier to build. There was two pieces of legislation that I specifically authored on the housing development front, which increased the number of affordable housing through density bonus programs, but also increase the opportunity to build affordable housing by exempting it from some of the bureaucratic things that get in the way, such as CEQA, which often delays projects in our communities. So I've talked about housing, because again, without housing, we cannot solve homelessness. But I want to recognize that I think the majority of you in this room, you spend your time on delivering the service, the wraparound services that individuals need. And I think that is probably where you can be the most effective when it comes to helping identify solutions for us who make decisions, for us who set policy, for us who write laws, and for us who decide how our dollars, our tax dollars, are spent in this problem. I believe that there is still a lack of fundamental understanding by, I'll say, myself and other members of the legislature on the significance and the importance of not just housing, but on the services that people need in order to be successful to exit homelessness. I think that we need to accept that as a positive criticism, that we need to do more, and that is where we need you. This is where you really come in, and it's very important for you to be part of this dialogue and this conversation, because we are attempting to solve problems, but we are not practitioners for most of us in the legislature. We are not practitioners, the most of us who are making the executive level decisions. You are the practitioners. You are the ones who know best. And that's why I tend to rely on what you all communicate to us in order to make better decisions as a state lawmaker. So I think I want to end by saying that for me anyway, you are critical for us to solve this problem. Again, acknowledging the work that you've already done, but we need to do more. We know we need to provide you with more tools, and that means that we need to hear from you and we need to learn from you. And sometimes we all think we do things best, or perhaps we've read enough and done enough research and we've identified the solutions. I don't think I need to tell this group, there is not one definitive way to solve the homelessness crisis, because everybody comes with a different story, everybody comes with a different experience, everybody has different needs, and we need to be able to meet each one of those needs on an individual basis if we are going to face and be successful in overcoming this challenge, which is a challenge for all of us. So I want to leave again by saying thank you, especially for those of you. I think the majority of you are from San Diego. As a native San Diegan, I've seen this in the last 43 years of life, the explosiveness of this crisis, and luckily we are taking this as serious as we should, but acknowledging that there's more to do, and we would not be here in terms of making progress, and we will not make more progress without you. So thank you very much.
And I appreciate the Assembly member. David really understands this, right? He understands the challenges and the barriers towards housing, but he values the work that you do and the supports that are needed. And we have an incredible champion in Sacramento. So once again, a warm round of appreciation. So when we started this morning, we had a fairly good group of folks, those early get here, get the parking spots, pick the back row, and now we have nearly a full room. So we are now joined with those of you who, show up on time, but not early, and those of you that clock in right at the hour. So that is the culmination of all of us in this work. Those early adopters who are always the first ones to talk in the meetings, and then those ones who come alive at the end of the day and exhaust all the rest of those that were awake. So we are in really good company this morning. And I'm excited that we're here for our second day of the conference. I want to, again, express my appreciation to our sponsors. Your breakfast this morning I'm getting a little bit of an echo, was made possible by YIGBY, Yes in God's Backyard, just an incredible group looking to be innovative in those solutions and using faith-based spaces for affordable housing. Adding those residential units on religious land is a way to get around some of the challenges that we have and also a way for them to give back. So really appreciate YIGBY and appreciate their support. You know, RTFH, we've talked a little bit about it. We're a unique organization, not just for the work. Someone said we're weird today. We're weird because we're doing a conference in San Diego specific to San Diego, and I'm just going to own that because I think that's fabulous. Why not? Why are we not doing this everywhere in the state, right? If people could see what I can see from up here, the commitment, the determination, the courage, and the dogged way that we go about addressing homelessness in a full room of over 1,000 people, people would not question, are we doing something around homelessness? They would begin to understand that there's an army of us out there, and it takes all of us and leaning into this space. So I'm going to own that it's weird to do a conference this way, but it's also critical and important, and in like true San Diego fashion, it's okay for us to innovate and lead. And this is what we're doing today. I often, again, say we're unique, and I'll share a little bit of that in our next two speakers. RTFH is a true nonprofit, but many people don't understand that. They think we're in government because we do federally authorized work. But I have a strong nonprofit board, and I have a fabulous continuum of care board. So I have the unique pleasure of having two boards with two board chairs. And so we're going to hear from them today. So first I want to thank them. We talk weekly, which I think for some board chairs that would be exhausting, and we are talking about homelessness. So it is absolutely exhausting and critical and important. And I have two of the greatest chairmen and champions in this space. And we're going to have some remarks from those. So I want to introduce my board chair for the Continuum of Care, Sean Spears, who will be followed by Ray Ellis, who is the chair of the RTFH's nonprofit. So it's my pleasure to welcome up Sean Spear.
Okay, good morning. Oh, guys, this is like already the second Good morning. There we go. Okay. And thank you all, and welcome again to day 2 of our conference here. Hopefully you've been able to build on your knowledge of how we are collectively addressing homelessness in our community, and hopefully making new connections with colleagues and also fellow leaders in our work. As many of you know, the work of the Regional Task Force and the Continuum of Care Advisory Board go hand in hand with each other, as Tamara was mentioning, providing resources and collaboration needed for us to maximize our impact on this crisis. As chair of the COC, I'd like to take this moment to recognize my colleagues on this board. So would you board members that are in attendance here please stand and accept our thanks for your work. Okay. Over the last 2 years, it's been my honor to serve with you all as your chair. Thank you for bringing your knowledge. Thank you for bringing your passion. And I know sometimes when people hear the word passion in the meeting context, they usually translate that to arguments and tantrums. For the record, I didn't ever have to put anybody on mute during a Zoom call, nor did we have any situations where I had to referee any fights. So thank you all for bringing your civil and bringing your best ideas to the table as well in a very respectful manner. I think it's safe to say for all of us that have served on the board, be we service providers, builders, advocates, and of course those with lived experience, that we've learned so much from each other as we've formulated solutions to address this crisis. It's daunting work, but it's sometimes when you have challenging work, it's great to have people alongside you that share a vision of wanting to make things better for people, especially those who have served on the board who are living with lived experience. Speaking of those folks and others, I'd want to share with you a news interview I recently came across with a man whose personal story may sound a little familiar to most of us. So if we can go ahead and start the video on that.
Honestly, I could not believe when I read the statistic, and I think, you know, Star Trek fans will know this, but that after Star Trek wrapped, you were broke and living in a camper van, trying to get the next gig. Can that truly be what it was?
Well, they saw that. Well, they pay. You know, if somebody's working on a salt mine, they would think it's a great deal of money. But because you spend a lot of money in Hollywood, that it wasn't all that much money. And then I was being divorced. How would you phrase that? I got a divorce. I was being divorced. In any case, my family and I separated, and I had to afford all that. And the show had stopped, and then when the show stops like that, when the series is over, the leads are characterized, so sometimes it's difficult to get other work. So I put together plays and did summer theater. And instead of trying to save money, instead of going to a hotel and taking airplanes or trains and things, I had a truck with a cab over the back, and I would do a 13-week tour of the East Coast, living in the back of my truck.
Camper.
My camper, to save money, and drove back and forth across the continent with the truck and my dog. I had one of my Dobermans with me, and that's the way I lived for a while.
So this, of course, shows how homelessness can affect anybody unexpectedly. It's our neighbors, it's our families, it's our friends. And in some cases, it's a childhood hero. So all of us, I really want to thank all of you for helping people like Bill Shatner. He didn't come out and say that he was homeless, but you listen to the story and you know where he was in that situation. Your help for people in his situation and others is invaluable. And as going forward, and at the risk of sounding a little corny, you do more than just are trying to help people through the situation. For so many of you who touch the lives of people who have been living and dealing with homelessness, you're also ultimately helping them to reach for their own stars in the future. So just want, from the bottom of my heart, truly want to thank you all. It's been an honor to serve as your chair at the board, and also to continue this fight alongside you as we go forward. So thank you all again, and enjoy the day.
Well, let's try it one more time. Good morning. Okay. Thank you, Sean, and thank you for all your great work as the board chair of the Continuum of Care and also the vice chair of the Regional Task Force on Homelessness. Sean's leadership style is thoughtful, collaborative, and produces results. So let's give Sean a big round of applause. This conference is the culmination of a lot of hard work by so many people and organizations. I want to take a moment to recognize some of those. First, I want to thank all of you for attending the conference. Reducing and solving homelessness is so important to all of us today. Last year, we had 740 attendees, our first year out with the conference. And this year, we've gone even bigger, maxing out at 960 attendees. So that's a great outcome. This year's conference is titled Peers, Partners, and Practices. And there's a reason that peers is listed first. Seeing the collaboration and sharing taking place in both is both heartening and inspiring. I hope you've enjoyed the conference so far. If you have a moment today or sometime this week, please use the Whova app and give us feedback on how we can make the 2024 RTFH Conference on Homelessness even better. So thank you for being here, but more importantly, thank you for being out there to work with those folks every day who need it most. Thank you. I also want to thank our sponsors. We deeply appreciate the commitment of 31 organizations who contributed to the conference. They include title sponsor, Blue Shield California Promise Health Plan. Lunch sponsor, Funders Together to End Homelessness. Breakfast sponsor, Yigby. The Whova app sponsor, Kaiser Permanente. Platinum sponsors, AARP and the City of San Diego. Silver sponsors, 211, Bit Focus, Brilliant Corners, LIST San Diego, Lucky Duck Foundation, and Molina. Bronze sponsors, Alpha Project, Corporation for Supportive Housing, Father's Joe's Villages, Jewish Community Foundation, J.P. Morgan, San Diego Housing Commission, Vista International, and PATH. The breakout room sponsor was Community Solutions. Champion sponsors, Jewish Family Services, Lazar Strategies, Pulse for Good, Rise Up Residential, and UCSD Homelessness Hub. Big thank you to all of you. There are a few more groups I want to recognize before I turn things back over to Tamara. First, I want any of our COC board members and RTFH board members to all stand, and COC again. These folks take time out of their busy schedules and busy lives and careers to share their expertise on the boards and our committees, providing vital feedback, unique ideas, and tremendous support. So please stand and give them a round of applause. Finally, a big hand to the RTFH staff who have made this two-day convening possible. It's the culmination of months of work by Tamara, Lahala, and the full team. From setting the agenda, raising money, determining logistics, and being available today if any one of you have an issue. The small but mighty team from RTFH has once again put together a great event, so please join me in thanking them. Now let me turn it back over to Tamara for a few more comments before we have our next round of breakout sessions. Thank you.
I never wear the right shoes for a long walk. Someone asked me how tall they are. Today they're 5 inches, just for anybody who wants to know. It's important, the shoes that you wear. You know, I want to thank my 2 board chairs, the important work that we do, and the board members. For someone who has the responsibility of a nonprofit and a community-based board, I have people ask me all the time, how do you engage such a large continuum of care board, 31 members, and a nonprofit board? And it is really something to behold and be a part of. that we have a competitive process for those that are on our COC board. There are a lot of people who apply to be on the COC board. People want to be in that decision-making in the space, believe in championing and ending homelessness. And I am so fortunate in San Diego that I don't need to encourage people to get engaged. It's why we can have nearly 1,000 people at a conference like this in San Diego. And I just really appreciate my board, my committees, but my 2 board chairs. Thank you. Thank you so much. You know, it's gratitude that's in my heart today. Many times this work is overwhelming and it is compelling in what it does. I am motivated every day. I'm an early riser. I'm a, as my team knows, 4 to 4:30 in the morning person. And I think it's partly because I want to get a jump on the work. I want to get going on things. But this work, it can be heavy and it can be challenging, and it is the opportunities that I start my every day with gratitude. And so I want to share that with you this morning. The gratitude I have and the joy that I have in joining and linking arms with each of you, from those who have been so generous to let me in your personal experience of your lived and living homeless experiences, to those who set policy and practice. So in staying in a place of gratitude this morning, and as this conference is a culmination of so much of our work, there are a couple of people I want to thank, and as many of our speakers this morning, it is really you. It is you that makes the work happen. It is you that we work for and in behalf of. It is you who may be in the finance team that makes sure that the bills get paid to keep the organizations running, that make a difference. To have over 1,000 people attend a conference, and you're not only attending it, but you're showing up, this ballroom is full, is evidence to the collaborative approach here in San Diego. There are over 164 unique organizations at the conference today, and you came in force. I don't know who's running those organizations today. I don't know who's doing some of the work. I know we have a lot of the Housing Commission here, so I know they're going to be doing double duty somewhere else. We have a lot of PATH here, a lot of our organizations, a lot of the county. I don't know who's responding to your emails, but I know that you, in dedicating 2 days, you are going to have a heavy lift when you get back to the office. You're going to have a heavy lift when you get back out in the streets, and so I appreciate it. I see you. I know what's piling up in your inboxes because it's happening at mine as well. So I appreciate you being present and purposeful today. We have had an incredible amount of speakers in this space. Over 140 people, different, unique people, have participated in plenaries, in our sessions, in panels. We'll have over 8 elected officials who are participating, and 19 of our board members. But I also want to center it in the voice of lived experience. Over 40% of those 140 unique individuals have lived experience. And I'll say this, 40% who acknowledge it, because I also know how many of you also have this experience somewhere in your background, whether your childhood or early, that have not shared it but have shared it with others. So there is a reason and a purpose behind what we do. And that is a powerful perspective. It is the knowledge that anchors our work and leads us, and you are leading us in important conversations and directions. I also want to thank our local government partners. I acknowledge the county, but also the city of San Diego, the VA. The county has a lot of departments, and many of them are here today, and we couldn't do it. This is a public-private partnership at its best. It is the only way to do this work, is to have that. And so just to honor everyone who is here, I also want to give you a little bit of what we have to come. We have some amazing sessions, but we also have an incredible keynote speaker and plated lunch. Dr. Margot Cashel will talk about the state's research and largest interview and research and data that has come out in this work in the nation for years. And it is impactful, and she is just an incredible, not only presenter, but understanding of the work that she does. Also, I'm hoping that the sessions have been inspiring and informational, and also making us just a little bit uncomfortable, because if we're not uncomfortable in this work, we're not doing the work. And so I appreciate all of you leaning into uncomfortable spaces and being able to stay there and get this work done. There's a full session on the cultural shift we're looking to do around reducing the disparities that exist in our system. Get in there and be a part of that. We also know that the dates that we scheduled our conference did not align perfectly with a number of our city meetings or county board of supervisor meetings. So I will also let you know that a number of our county board of supervisors wanted to be here. They were meeting late yesterday, but we will have Chair Supervisor Nora Vargas this afternoon. She will kick off the awards, also give us some closing remarks, and we will have our award ceremony. We had over 140 different people were nominated for our awards, and that is a nomination from your peers. And so we're really excited to be able to lean into that. Also, I'm not going to tell you the names, you have to come. But the one award that we will be giving is to State Senator Pro Tem Toni Atkins. We are going to honor her. You know, she has been a champion in this work long before she was also working in government and as an elected official. And so we are going to be honoring her with a lifetime achievement as a homeless champion. And so I'm hoping you'll join us not only to celebrate all of our awardees, but also to hear from Supervisor Vargas, to recognize Toni Atkins, and join us as we finish the conference in a spirit of gratitude and joy. I also just shamelessly have to do a couple plugs because it's really important. Point in Time is coming, so if you have not signed up to be a part of Point in Time, it takes 1,600 people to be able to do it. So there are places and spaces you can sign up. Please join us in that. Really a critical piece. And also, we want feedback on your experience and how the conference is going. Any suggestions, ideas, we are open. I think feedback is really important. And I will tell you, we read all of those and we'll take those into consideration. And so if you'll go into the Whova app and be able to give us any feedback or comments, we would really appreciate that. And so I'll send you off with just this. You matter, and the work that we're doing matters. And although it gets sometimes harder, it also gets better as we do it together. And there's nowhere else that I would want to be. We are so honored as an organization to host this. And we will continue to do this in our community in a way that we hopeful is thoughtful and focused on you and the work that you do. So thank you. Go take on the day.